All right, there we go. Now we're recording. Okay, so we're going to go ahead and get started. As I said, you want pen and paper or have your phone handy. We're going to share a lot of information. I know I've got a lot of recipes on there. Well, not a lot, but a lot of information you're going to want to remember later. And Alicia's got a lot of amazing recipes on here you're going to want to screenshot because you're not going to have time to write all that down. So have a phone ready to snap a picture. So let's get going. With every one of my classes, I do a disclaimer because it's really important that you guys know that I'm here for education purposes only. Contents of this presentation, it's not intended to substitute any professional medical advice, diagnosis, or treatment. It is completely for educational purposes. Don't replace a visit, a call consultation, or any advice of your physician or healthcare provider. In accordance with my state license, I'm licensed in Oregon and Washington. I am not permitted to provide any medical advice outside of a doctor-patient relationship. So if you are not currently working with me in a health consulting manner, or if you're not one of my in-person patients, then just know that if you ask a question in the chat and it's very specific, I'm going to generalize it and try to give it education and not advice, because I'm not able to do that. If this is your first time on one of my calls, you might want to know who I am and why I'm in front of you teaching a class about immunity. Well, I've been in the medical field since 1995. I started out as a respiratory therapist. I worked in my hometown in Alabama. I worked in a local hospital. I was an emergency room therapist for 10 years. Saw a lot of things, saw a lot of really sick people. I also did a lot of EKG reading as a cardiographic technician. Then I went back to school for massage therapy. I just needed to have a little bit more human contact in the medicine I provided. Then I decided I needed to be able to serve more. So I went to medical school. I became a licensed naturopathic physician. I had a practice in Portland up until last year when I closed that, and now I'm in Washington and Spokane area. So I'm also a certified grief recovery specialist, because what I found is that so many conditions are related to underlying unresolved grief. And so I do a lot of grief recovery work with my patients, as well as with people that want to have the work done. So I also do a lot of energy healing work. So I work beyond just a physical realm, because we're not just a physical being. We're a spiritual, emotional being as well as physical. And so I do work in that energy field. Some people say, like, what is energy work? Well, there's a lot of different ways to do energy work. There is Reiki, there is shamanic work, which is like old Indian medicine. You know, so I've trained with a lot of different practitioners and learned a lot of things. So I bring all that together in my naturopathic medical practice. I had extensive training when I was in school in nutrition, biochemistry, botanical medicine, which is herbs. I focused a lot on cardiopulmonary, so that's heart and lungs, because you know, that was my background. I also loved physical medicine because that was my background as well. So I do chiropractic adjustments. I do a lot of physical body work. Also use a lot of homeopathy. It's very powerful. It reminds me of oils, and I do a lot of counseling too. So in my internship, I did a lot of internship. I interned for a whole year with gastroenterology. I did physical medicine, cardiopulmonary, ENT, which fits right in line with immunity, nature cure, which we're going to talk a lot about tonight. I took a nature cure class in my first year of medical school, and then I was the teacher assistant for the rest of my time in medical school. So I basically took that class like 15 times. So I know that information really well. I use it a ton in my practice, because in my practice, I really focus on chronic viral conditions, which is related to the GI, and I'll explain how that is, and also chronic pain, the grief recovery, spiritual healing, anxiety, grief, mental health, all of that in the relationship with the physical, because to get whole healing, we have to address body, mind, and spirit. Currently, my practice is online only, and so I've had people after these classes contact me about being a patient of mine, and it's just due to the global health crisis. I don't have a physical practice right now. So online only is what I'm doing. So let's get moving along into what we're going to learn about today. This is exciting for me because I work with immunity every patient I work with. So we're going to talk about what is the immune system, the different types of immunity, how nutrition impacts our immunity, the role that stress plays, and how sleep affects it. And then the ways, of course, that we can naturally support immunity. And we're going to look at, of course, the doTERRA products for that. And then I've got some surprise offers I want to give to you guys at the end. Just because you're here, I'm going to offer those to you. So I'm going to start it off with just some basic definitions. Let me move your pictures out of the way. So looking at this picture, these are the terms that we're going to use in this conversation. So just know that this is going to help you just have a baseline. Pathogens, we hear about pathogens. So pathogens, that's the bad guy. It's a disease-causing organism that enters our body in one form. It could be through inhaling it, it could be through ingesting it, it could be a cut in our skin, it could be vaginally, rectally, it could be through the toenails, it could be through mucous membranes, and it could be so many ways, in your eyes, your ears, your nose. So many entry points that our body has for a pathogen to get into our body. And so there's a lot of ways that we can get different types of pathogens. So whether it's a bacteria or a virus that we're dealing with now, so we're trying to wear a mask, parasites, there's different ways to get parasites. So on this, you'll see a couple of little points here. So here's a square point, here's a cone-shaped triangular point. So these are called antigens. So these, they are part of the pathogen, and they're, as you see, they're found on the surface. And these are the parts of the pathogen that stimulates the immune system to do something. So once this pathogen enters our body, then this is kind of the waving flag of like, hello, here I am. So when the body detects the antigen, it stimulates an immune response, okay? And the immune response comes in, hopefully, the body creating an antibody, and we'll talk about that a little bit. And we hear a ton about antibodies going right now because it's a big thing, because we can't fight things if we don't create antibodies to it. And so as you can see, these are little Y-shaped proteins, and they're produced by our B cells. And I'm going to explain what that means. Just remember, the antibodies are made by our B cells. And this is in response to that exposure that we have to that antigen. So these are some three definitions you're going to hear a lot: pathogen, antigen, and antibody. Just remember, antigen is what our body recognizes, and the antibody is what we want our body to create to fight it. So we have some organs that really play a big role in that recognition and in the response. So first of all, we're going to just scroll down the line. So let's consider we're either inhaling or ingesting a pathogen. So the first line of defense, of course, is going to be our skin and our mucous membranes, just because that's a protection barrier. But once it's inside, our tonsils, and up here in the left-hand corner, you can see tonsils are on the side. There's two of them, one on each side, and adenoids, which is above the hard and soft palate here. And so when those glands, so they are glands, are exposed, so the whatever it is, the substance that is passing by that area, because think, everything you swallow, everything you inhale goes through that canal that has those three guards around there, around that area. So you've got adenoids and tonsils there. So if they're constantly exposed to something and they're having to react to it, they're going to become swollen over time, because we know a ton of kids that have their tonsils and adenoids taken out because they're over inflamed to the point that they're obstructing the airway. So tonsils and adenoids is an immune gland. And then we have the spleen. And the spleen is a small organ, and on women it's like under the left breast. It's kind of below your axillary, which is your armpit, so it's below that as well. And so I've got this picture because it's a great way to show, because your spleen, like if you reach around your body, you can reach it, but a lot of times you're just going to reach the tip of it with your fingertips. Like you can see this woman here. Excuse me. So the spleen is really important because it's a filter. So the blood goes through the spleen filters out any like dead red blood cells and then recycles. And so it's really important in helping fight bacteria of like meningitis and pneumonia. It's really important in those two cases. And so a lot of people don't have a spleen. You know, you may say, well, I had my spleen taken out, or a lot of times you'll hear of a spleen being ruptured in a car accident, and that's fairly common in a side collision. Because you can see here, if you're the driver, if you're the passenger, like I'm having to like figure out on my body, if I'm the driver and they hit me in the driver's side door, there's a strong likelihood they might cause some damage to my spleen because it's on the left side of my body. And so that door usually is a good impact point on the spleen. And so a lot of times the spleen is removed, and it can be removed because we've got all these other immune glands that are going to come in and compensate. But if we have it, then we have that extra support of the spleen providing that additional immune support. Then we also have Peyer's patches. And I know lymph nodes are on here. I'm going to save that for the next slide. I'm going to go into it a little deeper. Peyer's patches they're kind of like the tonsils of the intestine. So they're found all through the wall of the small intestine. And so what they do is kind of like the tonsils and the adenoids, they capture and destroy bacteria that goes into that intestinal wall. So when things are in our gut, whether it's a bacteria or a virus or a parasite, that Peyer's patch, those Peyer patches are trying their best to manage that infection. So that's really important for later. We're going to talk about really keeping your digestive system in good order. We're also going to look at lymph nodes. So here's some areas you have lymph nodes: in your armpits, in your neck. So you have them in the front of your neck, in the side, and in the back. You also have them in the groin area. And so this may be something that you have noticed that is swollen or tender after you had a known infection. So let's say you had a really bad cold, and then next week you felt a little lump under your armpit, or maybe while you're sick or immediately after, you feel your glands in your neck are swollen and really tender, or in your groin area you might feel that. And that is because those lymph nodes have been busy catching those pathogens and taking care of them. So they're kind of collection areas because the lymph nodes are collection areas. And in those, we're going to look at lymphocytes. So these are white blood cells. We're going to talk about it a little bit more in detail so it makes sense to you. But the two that we're going to talk about is B cells and T cells. So let's dig right into the lymph system. So lymph is really important. There's some ways I'm going to help you guys know later of really how to support your lymph system. So lymphocytes are the cells that are in your lymph nodes and in your lymphatic system. If you've ever had the great opportunity to get a lymphatic drainage type massage, you know that it's very soft and superficial. So it's really gentle, and that's because the lymphatic vessels are right under the skin. And so a lymphatic massage is really, it almost just feels like they're just sweeping on your skin. And it's because they're moving that lymph flow. Because if you go too deep, you're past the lymph and you're into the blood circulation. So in that lymph tissue are blood cells, and we have white blood cells that are in there, and they're very specific for immunity. The three major types we're going to talk about: T cells is one. So I've got this little cartoon up here so you can kind of understand a little bit, and here's another picture of them. So T cells, they are produced before we're born in the liver, and then once we're born, they start being produced in the thymus. And the thymus is right behind your sternum, And I've always done this thymus activation technique where I just like tap that thymus, because sometimes even if you're like sleepy, you can activate your thymus, but it really kind of stops producing T cells after the age of puberty. Hang on just a minute. You guys know I'm a sprayer with my dogs. They're over there acting crazy. I have French bulldogs and they have a mind of their own. And so T cells are produced in the thymus gland, and then once you hit puberty, you've kind of got all of the T cells your body's going to make. It's not going to make anymore, but it makes a lot, and they're very specific, and so they know they are divided. And but so that specificity, by that I mean they're divided into purpose. So you have a ton of T cells that are made by the age of puberty, and you might have T helper cells. So they're called CD4s, and those are helper cells. And there's lots of helper cells, and they are for a variety of reasons. And here's an example, and they're called TH cells. And so a TH1 is the cell that when your body recognizes you have a pathogen in there that it needs to create a fever for, your TH1 cells go to work. They are the cells that cause your body to raise your core temperature, those TH1s. So you see, fever is a great way to help your immune system do its work, because I hate to hear people say, oh, I feel like I've got a fever, I'm going to take something to bring it down. I'm like, you just put a roadblock on your body's immune system, and you're not allowing it to do its work, because our body wants to first go in, put those TH1 cells to work of raising that core temperature to try to eliminate, because a lot of pathogens cannot survive when they are exposed to an elevated temperature. And so our body knows how to regulate that temperature. If you're a patient of mine, I'll teach you how to manage a really high temperature, because I like high temperatures. I can try to raise my temperature because I don't want to handicap my immune system. And then there's tons, like I said, there's TH1, there's tons of TH2, 3, 4, 5, 6, and it just goes on and on. So there's tons of TH cells, so that tells you those are helper cells. They're cells in your body that are helping your body initiate this immune response. Then you have CD8s, and these are killer cells. And so they will actually like find an infected cell and attack it, and they will kill it. And you can see up here in this little cartoon, it says, I attack infected cells. So this is a killer cell. And that's exactly what they do, is they go in and they actually have some proteins in there. It's called perforin, and and it perforates. It will plug a hole in a cell so that its guts basically spill out, and so then it can't replicate. So like, take a virus. If your T cells are like really healthy and your fever is trying to kick itself in, and then your killer cells kick in, it's going to go in and poke holes in those virus cells and try to wipe it out. So that's T cells. Then we have B cells, and you can see I attack invaders outside the cells. And so here's what we're going to look at. So B cells, you can remember, T is made in the thymus, B is made in the bone marrow. And so it's made in the bone marrow, but then it's stored in the spleen. And so you can see again why your spleen is an important organ, but don't worry if you don't have it, because there's a lot of other ways that the body compensates. So the purpose of B cells is to produce those antibodies. And you can see on the top of this little blue cell up here, this is a little antibody. That's what that is. You remember those Y-shaped proteins that we looked at up here in the definition slide. So that Y-shaped antibody. So that's what B cell does. It's going to produce antibodies, and it's also going to help the body remember that invader. So let's say you were exposed to something, and then later you're exposed to it again. Like chickenpox is a good example, and I know that there's some rare cases where people get chickenpox over and over, but typically, once your body is exposed to chickenpox and you have chickenpox virus and you go through all of that trauma and you know, we know that it's kind of torture, but once you recover from that, your body has developed antibodies. So the next time that you're exposed to chickenpox, you typically will not have a immune response because that you know of. Your immune system will be like, oh, wait a minute, I remember that. Hang on, I think in my inventory, I've got some antibodies that will take care of that bug. And so then it stimulates the B cells to be like, okay, let's remember, do you guys remember this chickenpox guy? Let's go get those antibodies. And so then the antibodies go and they kill the virus before it has time to do anything in our body. The third type is natural killer T cells. So these are also T cells, but they're really highly specific lymph cells. And so they're specific in that they will go directly to tumors in cancer. They'll also go to the virus infected cells, and they will just attack and kill. So remember, again, they have those perforin proteins where they'll poke holes in it and they'll do everything to try to kill it. So we got T cells in the thymus, B cells in the bone, natural killer cells. Those are a subset of the T cells, really highly specific for tumors and viruses. Okay. And Alicia, anytime during this that anybody has questions, just unmute yourself and ask me to stop somewhere. So Alicia's gonna manage the chat while I keep going, and then we'll answer questions as we go, just so that you guys, I definitely want you to be in the know and feel like you're understanding things. Okay, so we have two types of immunity that we're going to talk about. There's a couple others, but these are the main two. So we have innate immunity and adaptive immunity. So if you just think about those two words, first of all, innate, we're born with it, okay? I'm born with the skin on my body. I'm also born with some chemical barriers, whether that be sweat, tears, saliva, mucus in my nose, mucus in my digestive tract. There's a lot of chemical barriers I can have. We also have things like cellular defenses. So like I have cells in my body, and I'm going to show you some cool pictures later of cells that will immediately go and protect the body. So what you see here, this is a white blood cell. And so we have certain kinds of white blood cells that really love to just be like, nope, I'm just going to ward you on out of here. And so when we have an infection, that's why our white blood cell count goes up. One, our lymphocytes that we just talked about, they multiply a number there. So they're going to, so all of those are going to, that's why when you go to the doctor checks your blood work because he wants to see if your white blood cell count is elevated, because that's going to help him know if it is an infection. And they can break down that white blood count to see what type of white blood count, because that's going to help them know if it's a virus, bacteria, parasites, allergens, things like that. So that's all the innate immunity. So we've got physical barriers. So we're born with that, right? And so then we have an adaptive. And adaptive means that our body has to adapt to some type of exposure. And there's two types of that. And there's active and passive. So active means there is some type of physical exposure that is happening for us to mount an immune response. An example of that is a natural exposure. So you have the flu and I come to visit you and I sit beside you and I stroke your forehead and I take care of you. I have just exposed myself to the flu, and then I develop flu symptoms in the next couple of days. Well, then, or actually let's use chickenpox again, because then I'm going to mount that immunity to the chickenpox, just like we talked about earlier, where I develop antibodies to it. And that is an active immunity. So it's a natural one because I was naturally exposed to the antibody. I was naturally exposed to the pathogen. I created antibodies in my own body to this pathogen. And so that gives me an immunity to chickenpox. The artificial way, so there's natural and artificial on both of these. So the artificial way is vaccines, because vaccines, the majority of them are giving you either the majority of vaccines are dead antibodies. Some are live, but the majority are inactive. And so when you get a vaccine, your body is still going to recognize that and create an inventory in that memory bank of antibodies for that pathogen. So again, let's say you didn't get chickenpox, but you got a chickenpox vaccine. And during that time, after your vaccine, you were exposed to chickenpox, but your vaccine had given you the ability to create those antibodies yourself. And so then you did not contract chickenpox after you had that. Now we'll talk a little bit about vaccines. I'm not going to go onto my soapbox about vaccines. I will talk a little bit about it because vaccines take a very long time to create and perfect and to make sure that there's no side effects. So, they work on them for a long time to get that happening. So so that's active. So in active, we've got a natural exposure where our body naturally creates antibodies, or we get a artificial exposure where we create antibodies based on that inoculation of a pathogen. And then there's passive immunity. And so this is where those antibodies are provided to you passively, meaning you didn't really have a part in it. So maternal is a good natural example where the mother will pass antibodies onto the baby, both in the womb and then through breast milk as well. Artificially, this would be an example of this is someone that's having to receive antibodies. And something that some of you may have heard before is like an IgG treatment. They may say, I'm having to get IgG through an IV. And they're getting antibodies through an IV because their body is not able to create them. And so we can actually give antibodies in a form of an IV so that our body has those to fight whatever it is that is needed for. So I hope that makes sense. So just remember, we have a very innate way of providing immunity, and then our body also has an adaptive way that it does it. Okay, hope that makes sense. The last part I want to talk about is, I'm sure you guys have heard of herd immunity. And so I just want to talk about this because I know that we're hearing some of this on the news. And so a great example of herd immunity is the measles. So many, many years ago when the measles first came to be known, so over here on the far left, we're going to see this little pathogen. You see this pathogen? This is a measles pathogen, let's call it that. And so this pathogen was introduced into the herd, and the herd just means population, okay? And so once the measles was introduced to the herd, then nobody had antibodies, right? So everyone was at risk. And as you can see, the majority then had an infection. As this continued to move forward, this guy moved into another population where some of these had already been exposed, maybe had had the sickness, had recovered, and had developed antibodies. And so they, as you can see here, the striped ones, they had immunity because they had developed antibodies. And that continued on until this was, lessened and lessened of people that were contracting. You can also, and this is in herd immunity of like where people have either had the disease and mounted antibodies, or that there was a vaccine, because with measles, once I think the vaccine was, oh gosh, I can't remember the date, once the vaccine was created for measles, then the amount of people that were vaccinated created a greater number of herd immunity. And so let's review all of those types of immunity really quick, because we're about to dive in a little bit more of some stuff. So innate immunity, you're born with that. Here's one thing I want you to remember. It doesn't have memory, okay? It's just your skin protecting you, your mucous membranes protecting you, you know, things like that. So it's not going to have a memory for things. But then we have that adaptive, and the active type does make antibodies. Remember that natural one, when I'm exposed to chickenpox and I've never had it, and I get chickenpox and I develop antibodies. And then the other way is through like a vaccine, you know, things like that. So I put these on here. They do seem a little complicated. So there's that naturally acquired active immunity. So this was like the person on that picture that had the infection, or artificially acquired active immunity. And this was the vaccine that you saw. And then one thing that you want to remember here is that like the flu vaccine. So when you get the flu vaccine, you're getting it for specific strains that are considered to be the most common in that season. And so you will build antibodies to those strains. And a lot of people say, I got the flu vaccine and then I got the flu worse than I've ever had it. And that can absolutely happen. One thing is that your body can mount an exaggerated response to it. And during that moment that you're exposed to that live virus, your body takes it and replicates it. But so, you know, I have a lot of people ask me my opinions on the flu vaccine, and I won't dive into that tonight, but just know that any vaccine of a nature like that, like the flu, and I was trying to think of another one the flu is probably the most common, where the strains are changing all the time. And so you're hoping that the strains that they've chosen to put in the vaccine that year are indeed the most common. And then again, we have the passive. So those are non-active. You're actually receiving the antibodies, and this would be like through maternal passage and the naturally acquired passive immunity, or you're given antibodies either like through an IV, and the IVs can be antibodies. And so the antibodies are something, that solution, it's antibodies that are made either by another human or an animal. And so an example of that would be like rabies or tetanus is a great example of that, where you're given a rabies, you know, animals are given rabies shots and humans are given tetanus shots, because we need to be proactive in that and make sure, because once we are exposed to that pathogen and we don't have those antibodies, then it puts us at a higher risk. And of course, there's that herd immunity. Hold on a minute, I call it shooting the dogs with the water. I know.
While you're doing that, there is a question.
Okay.
There's a question. Brandy asked, does everyone who develops antibodies from exposure have symptoms, or can you be exposed, be asymptomatic, and still develop antibodies?
That question does make sense, Brandy. Thank you. So that's a great question. I think you definitely could develop antibodies without severe symptoms, but I think you would, especially if it's a viral infection, to build antibodies, you have to have enough of a exposure for your body to have an immune response to develop antibodies. So you can be exposed, be asymptomatic, and still develop antibodies. My opinion is no. I think that you will have antibodies. You will have symptoms if you develop antibodies. And on that note, I'll talk about some of that a little bit more, because as you guys may or may not know, like my partner works at a lab, is also a doctor, and they are testing every day for antibodies. And so I'm going to talk about that just a little bit. Was that all of the primary questions? Then I can move on?
Yes, yes.
All right, thank you, Alicia. Okay, so good, here it is. So I want to talk a little bit about immunity and the global health crisis. So because all of our minds are on COVID, so let's just talk just a little bit about those antibodies and how that is working. So what we're seeing a lot too is like severe cases of COVID, you know, or if someone has it a second time around. Well, what we're seeing is in some of the research, they're seeing that those antibodies are actually like splitting the viral cells. It's almost like they're like super aggressive. And when they split those cells, they're basically like opening the cell up, then the viral DNA is exposed and it can actually like become fatal. Also, what we're seeing is not everyone is actually making antibodies. And when you don't create antibodies, it is definitely fatal. And so I think that is some of the research that they're looking at to see if that is some of the causes of the numbers, is that they're actually not creating antibodies or enough antibodies, or not creating them quick enough. And so a lot of times we're seeing definitely that the second time around that it definitely can be a fatal situation. And this is a big question about the lifespan of antibodies, like how long do they last? Well, you know, most of them, so like let's say chickenpox, they are typically like lifetime long. Once you've built those antibodies, they stay around forever. And so this is a big part when they're developing vaccines, is to get the life of antibodies long, because you want them as long as the person lives, so that if they're exposed to it ever again, they don't have to get it. But like with the pneumonia and the flu and shingles vaccines, all of those antibodies don't last long. Also, they may be different strains. So like flu, there may be different strains, but depending on the life of the antibody, you may have to get re-inoculated every year, just depending on the life of the antibody. So the life of the COVID antibodies, it is very unknown right now. They're just not able to pin it down, but they are really suspecting and theorizing that it is a really short lifespan. So my partner, where they're testing for antibodies, they're almost seeing 0 positive cases of antibodies. So that means people that have been exposed or that have had a positive antigen test. Remember that antigen and then the antibody that responds to that. So they might have a positive antigen test, but then within 14 days, which is how long it takes your body to really mount an antibody response, they're negative. And so that is actually causing a lot of concern, in that the antibody lifespan may not be long. And so then there's a lot of question of, well, does that mean that if I've had it the first time, am I immune to it the second time? Well, if antibodies are not lasting, then immunity is not there. And so you just want to, that's the case where we're seeing a lot of these second cases being a little bit more severe. Okay, and so that's about all I'm going to talk about that. I just want to let you guys understand that, with us talking a lot about antigen and antibody and really understanding how that works, just so that, you know, you guys are hearing a lot of news, and so just know that they're really just trying to figure it out. They're studying it. It's a new virus as far as that strain. Coronavirus has been around forever, but the Corona-19, that strain is very different than anything that we've seen in a long time. And so it is kind of reminiscent of some past viruses. You know, we think about measles and polio, you know, that had a lot of negative effect before the vaccine was actually developed, that would provide those long length antibodies that would be around to for multiple exposures after that. There's also autoimmune to talk about. if you've been on any of my classes, you know my idea on autoimmune. And if you don't, you might want to be a patient of mine because I have some strong opinions about autoimmune that I won't share here. But here's some autoimmune conditions. Lupus, Hashimoto's, so that's low thyroid, or that your body has created some antibodies that are actually affecting your thyroid tissue. Rheumatoid arthritis, celiac, Sjogren's disease, multiple sclerosis, polymyalgia rheumatica, ankylosing spondylitis, type 1 diabetes, alopecia areata, vasculitis, temporal arteritis. And so here's the cool thing. This is what I've been practicing for years. And so now I'm loving that the studies are actually showing that there is a strong correlation between Epstein-Barr virus, which is my specialty, and 7 autoimmune disorders. I'm sure they're studying a lot more, but the ones with the asterisks are the ones that they have shown the correlation between Epstein-Barr and these autoimmune disorders. There's 2 other autoimmunes, juvenile idiopathic arthritis and inflammatory bowel disease. So, and it's because, I'll touch on it a little bit. Autoimmune basically means your body is self-destructing. My belief is that God made a very intelligent body that does not have a self-destruct button. But could it have a pathogen that we don't know how to detect, or you may not think to test for? Because when I get any of these conditions right here, I immediately test for Epstein-Barr virus, always get strong positive, like numbers through the roof. When I start treating these patients as if they have Epstein-Barr virus, I get amazing results. So just know that that correlation helps us know that the Epstein-Barr virus has a strong possibility of being an underlying condition in some autoimmune disorders, if not all of them. So it'll be interesting to see the studies moving forward to see if there's correlations in the rest of those. So enough about autoimmune. Okay, let's talk about nutrition. How do we support our immunity through nutrition? And speaking of, I'm gonna grab some water. So the first 2 are amino acids. So we hear a lot about lysine, and you hear a lot about lysine with things like herpes, shingles, things like that. And the reason for that is lysine and arginine are kind of a seesaw back and forth. They kind of help balance each other out. And so when lysine gets low and arginine gets high, then people that are prone and have an underlying herpes infection, which the majority of people do, then that will, then you'll see that reactivated. And so arginine is needed for macrophages. And this is the macrophage down here in this little picture, and it's a white blood cell that's like a Pac-Man. And they literally go and they open up just like this guy, and they engulf pathogens. They just literally eat them. And then once they close the hole around them, they engulf them, and then they just dissolve them inside there. So arginine is needed for those macrophages. Lysine, when we have the right amount of it, it helps to increase the number of T cells that are working for us. You remember those T cells, we've got a certain number of them, but we want to keep them active and healthy and working for us. And so it helps to increase that number. It also helps increase the absorption of zinc. And we'll talk a little bit more about zinc, but we know that the majority of low immunity situations has a zinc deficiency. If we ever, like I can do a zinc, it's called a zinc tally test. And so it can help you know if your zinc is low. And if it is, then we'll start to provide zinc heavy foods and even zinc supplementation if needed. So vitamin A and zinc together, they help regulate cell division. And so what this does is it helps reduce the pathogen replicating, because those pathogens love to get in the body in that warm, moist, dark alley and just start replicating. So you'll take what happens in that cell division, you'll take one cell of a pathogen and it will split in the middle and become two. And then that one will become two, and then that one will become two. And they just keep dividing. And that each time they do, they're doubling their numbers. And so have you ever felt like this evening, I just don't feel good. I'm just, I got a little bit of a scratchy throat, and, maybe it's nothing. And you go to bed and you wake up the next morning, you feel like death warmed over. I mean, you feel horrible. You're like, how did I get so sick so fast? Well, it's because while you were sleeping, or while you were working, whatever that time span had, then all those cells were splitting, dividing, replicating, making more. And so those viruses will really, or even bacteria does it, they grow in numbers, and that's why you can become really sick really fast, is because of that. So look, if you've got vitamin A on board and zinc on board at a really good level, then you're reducing the chances of that cell being able to replicate so quickly. And so then that helps to support your immune system. And your immune system completely relies on zinc, the vitamin A, B6, C, selenium, C and E, selenium, copper, iron, and folic acid. And so, and one point I want to make in this is that iron is a really big one, in that if it is over supplemented, it actually can impair the immune system as well. So you're thinking, well, I'm going to take a lot of everything. Well, that is not intelligent, because we need optimal dosing. Because when we have optimal dosing, it gives the body how much it needs and not more, because once it has more, it doesn't really know what to do with it, and it can start to hinder things more than it helps. Undernutrition is definitely a common issue, especially in these three. Vitamin E, it's called an immunomodulator, and what that means is sometimes our immune response can get overactive, and that can kind of stimulate inflammation and all that. So vitamin E, if your immune system is over exaggerating, it can calm it down. If it's under reacting, so it's not reacting as quickly as it needs to or as strong as it needs to, vitamin E can bring that up to balance. So it's a kind of a balancer. It modulates it. Vitamin D is really important because we have receptors on the majority of the immune cells. And so if we are low in vitamin D, those immune cells are depending on that vitamin D, because up here in the Pacific Northwest, we don't get a lot of really good high quality sun. And so we have to supplement with vitamin D. If somebody comes in and they've got a low immune system, that's one of the first things we start looking at, is like, you got, vitamin D on board. And so the things that we may see in typical vitamin mineral complexes might have enough vitamin D for people that are in an area and have plenty of sun exposure. But in certain areas or in lifestyles, you may just have to supplement all the time. Vitamin C, it's known to be a really supportive immune compound, but it supports both the innate and the adaptive immune system. All right, I just noticed the time.
Before you move, there's a question.
Okay.
Do the zinc drops help after you have symptoms, or by that time is it
too late?
Is it too late?
Well, it's never too late. It's never too late. So because what you're doing is you're really helping the whole system kind of like come back online and supporting it. So what we do is if someone has like a chronic issue, we'll have them on zinc all the time. But like for myself, once I got well, because I was really sick for a few years, once I got well, we keep zinc handy in a tincture bottle, and at the first sign of something, you just start taking it. Like the first scratchy throat, the first anything feeling off, start taking the zinc and hit it hard. Anytime you fly is amazing to take zinc because it just really helps kind of boost that immune response. So yeah, no, it's never too late. Good question. And so the way that you, with your doTERRA account, can support your nutrition is our Lifelong Vitality Pack. This is why I love this system so much, is because it has the perfect variety of vitamins and minerals and herbs in it, but it also has the right dosing. Because remember, I was talking about how too much iron can actually hamper and impair your immune system. This has the right amount of everything. Like I was even looking at it yesterday, looking at the dosing, and I was like, I'm just like shocked every time. So it's got vitamin A, C, E, all the Bs, including folic acid, vitamin D. Like I said, if you're in an area or if you don't go outside a whole lot, then you want to look at supplementing the vitamin D, zinc, selenium, copper, and iron. So if you are not yet taking the Lifelong Vitality Pack, I highly recommend it, if no other time, to get you through March and take the full dose if you can at all. So definitely recommend this, taking Lifelong Vitality in the vitamin mineral complex, the alpha CRS, and the omega. You can do the vegan omega if you prefer to, and if you need to. I recommend the vegan omega for anybody that has a chronic viral condition, just because fish oil kind of tends to feed that. So, okay. All right. And then let's talk a little bit more about nutrition. So there's also some tissue. It's called gut-associated lymphoid tissue. Remember, we talked about those Pyre patches. Here they are right here. See those Pyre patches? So this is your gut lining, okay? This is your gut lining, and these are the little hair-like structures on the top of those cells. This is a Pyre's patch, so this is a immune cell, and so this is see, and here's a lymph node. Mesenteric just basically means in the gut. And so, and then here's some lymphatics. There's a B cell. Look at that little Y-shaped protein. What do you think it is? Antibody. Yep. There's a T cell. Look, remember us talking about a lot of different types of T cells, like Th1 that stimulates a fever. There's a Th2, 17, and there's one called Tregs. There's those macrophages. Remember those Pac-Mans? So see, this is all your gut-associated lymphoid tissue that is about immune system, because this is where the majority of our immune cells are located, in our gut. Did you know that? Did you know that the majority of your immune cells are in your gut? What if your gut is not working 100%? What if you're constipated? What if you have diarrhea? What if you have Crohn's disease, IBS, IBD? What if you have celiac? What if I could go on and on. Do you think that your immune system is top notch if your gut is already having some other issues? Maybe not. What if you've been on a lot of antibiotics? You've been on antibiotic therapy. The effect of that is super detrimental to this lymphoid tissue right here. So if you've been on antibiotics, you know we need probiotics, but we also need the prebiotics. So we need pro and prebiotics are needed. And their studies show, like I was reading a study this week, it was showing that the pro and the pre are paramount in repairing the damage by antibiotics in this gut-associated lymphoid tissue. So you're going to find that in the PB cyst. So it's really important that anytime that you or anybody you love is on an antibiotic, that you get them on the PB cyst. Also, if your gut is not working well, you want to support that, right? So you want to make sure that that Terrazyme is a really important part of your regimen, because you want to make sure that, so let's say you are constipated, then that means there might be some food matter sitting up here on top of this, smashing down those little hair-like structures, really interfering with the communication that could happen between this is called intestinal lumen, which means the area, the opening. And so if there is material that is sitting in here and you're not being able to break it down. You might need digestin Terrazyme to go in here, break that down so that it will pass along in the intestinal tract and give you this space where this communication can happen and that those immune cells are able to work. So let's talk about the stress impact on immunity. Well, there's studies that show that chronic stress actually reduces the immune response. And so an example of that is anybody that has chronic stress, we typically see anxiety and depression be a very close correlation there. And we know that chronic mild depression reduces T cell responses to how it's going to respond to viruses and bacteria. And so what that means is that when we're exposed to something, it may not act as quickly or as aggressively as it would had the depression not kind of suppressed that. And how can we support that? Well, we can support our stress response through oils. We've got adaptive, which is amazing for stress. If you have anxiety, depression, I highly recommend the adaptive capsules as well as the oils. Balance is great. Peace is great. Meditation is amazing. And oils with meditation and breath work is phenomenal. Journaling, walking in nature. I do classes on breath work. I'm working on one right now for next month. So breath is really important. We may think that we breathe, and sometimes we just really are not getting adequate breath. And then sleep is also super important because that's when we heal. You know, that sleep is that restorative time. It is paramount in a healthy immune function. And so there is a theory that for every 1 hour of sleep before midnight, it equals 2 hours after midnight. So it's a, you know, it really, the truth of it though, is that the deepest sleep is going to be within the first 1 to 3 hours. So whatever time you get to sleep, the first 1 to 3 hours is the deepest sleep, and that's where that most restorative sleep comes. So there's ways to support the sleep. Of course, we have our Serenity Restful Complex. We have a Restful Blend. Frankincense, I love frankincense for that. Vetiver is also another one. I forgot to put it on here. I have a lot of people say, you know, I just can't shut my mind down. Well, this is I call it a thumb finger game. One of my mentors in medical school taught me this. And it's best if you do it with your non-dominant hand if you can't shut your mind down. And so you can see here it says 1, 2, 3, 4. And so you're wanting to touch finger to thumb in no pattern. You cannot repeat the pattern. And this is what shuts the thinking process down, is because then you have to stop thinking about what you're going to do tomorrow, what you forgot to do, or what you've got to do at work tomorrow, or where you got to take the kids, or whatever's on your list that's running in your head. You can't think about that because you're thinking about which one did I do last and the pattern. And if you're not asleep within 1 minute, you switch to the other hand. Non-dominant hand works the fastest. So that's a good technique to shut your brain down. Another technique is taking deep breaths. And what you do is you literally focus 100% on your breath, and you count how many breaths it takes you till you fall asleep. So you know how when you go in for surgery and they say, breathe through this mask and count backwards from 100, and you go 99, 98, bye-bye. Well, that's kind of what happens with this breathing technique, is you start counting how many deep, slow, full, relaxing, and you're fully relaxing on the exhale, how many it takes to fall asleep. And then Papaya is great for helping you with your sleep as well. We know that it's an immune modulator, and we know we talked about that, which means it brings it back into balance. Whether it's high or low, it's going to bring it back into balance. It's great also if there's pain or anxiety. It's great to take at night right before bed to help with that sleep quality. And now I'm going to turn it over to Alicia. Alicia Pritchett I'm so blessed that she agreed to work with me on these classes, because she is a certified in aromatherapy, also in reflexology and holistic wellness. She's actually doing some more schooling now on the holistic wellness, and then she's certified in flowology. So I am going to turn this over to her and let her talk to you about oils to support the immune system and get your phones ready because she's got a ton of really great recipes. And Alicia, do you want me to, well, just let me know when to advance the slide.
Okay. Thank you so much, and I'm so glad to be here. I am going to kind of change direction a little bit and talk about how to support our immune system using oils. And some of these, I won't talk about every one of these oils. And this is such a short list because basically all oils have the potential to address things that compromise or attack us. Because if you just think about plants and how the essential oils protect the plants from illnesses, and so you know, they do the same for us. And so there's probably not an essential oil that that you could use that would not help you in some way with your immune system. So I do want to say that the immune system, what I love to do most is to connect the mind and the body. And because we are one functioning, you know, being, our mind and body work together. And so our immune system represents integrity within our body. So this is usually how you feel about yourself and about life, and the emotions that the negative emotions that you may feel when your immune system is got some stuck energy or compromised would be hopelessness and unworthy, overwhelm, and just, you know, unworthy. Because when we vibrate low with these low emotions, then of course our immune system is compromised. And so we want to use the oils to help bring our vibrations back up. Okay, you can advance the slide. And so there are a few different ways that you can use oils, and all of you guys I know are experts at oils, so you probably got all this stuff down pat. Maybe I'll mention something that you don't already know. But here's just a few blends that I put together, roller bottle blends that could help with supporting your immune system. So if you want to screenshot them, you can do that. And so topically, of course, with our roller bottle blend, you could put them right over your lymph nodes, on the bottom of your feet. It's always a good place. When I'm addressing, you know, something that's attacking me, I go for the lymph node. But you could also roll it up and down your spine, or have your you know, your partner do that, or child, or anyone, or you can roll it up your children's spine. I do that a lot to my grandbabies. They have their little roller bottles for immune system support, and that's a good place also, is the spine. Okay, let's talk about another way, is diffusing, like Delores was saying, breathing, taking deep breaths, but also getting these oils into the air that you breathe is, of course, the easiest way to use oils, is to diffuse them. And these are several different little diffuser blends that you could maybe find one that you like. And all of these oils are just so good, supporting the lungs and the digestive system. And that's what we're going to talk about next. Everybody, if you didn't get a screenshot or you want to go back, just let us know and we'll move on. So she mentioned that I do reflexology. I'm a certified reflexologist. I'm also certified in flowology, and several of you probably are on this call as well. And so this is where I would target the digestive system for supporting your immune system, because like she was saying, your digestive system is connected. It's connected directly to our immune system. So digesting is basically assimilating life experiences. for example, you might ask the question or think about what's eating me. What is eating me? That's, you know, something's eating at you. That's your digestive system. That is your stomach. Who can you not stomach? Who or what can you not stomach? What's going on that you cannot stomach? And that is going to give you a signal that you may want to address supporting your digestive system. So the stomach, and right here are the points on the I tried to get something that just had the digestive system. I can't find anything, so this was the closest I could find. So we would start with the stomach, which is this circle here, and we would use Manuka. And the reason, the stomach, we feel anxious feelings in our stomach, in the pit of our stomach. When we have fear, it grips us in the pit of our stomach. We could feel unsupported if we have that kind of gripping fear and mistrust. So Manuka is the oil that I chose here. Now you can change this up if you don't feel like that oil addresses what you need, but this is what I chose. So you guys can try it out and see how you like it. And if you don't have Manuka, I would use Adaptive, or Tulsi would be another choice. But Manuka is the oil of being upheld. So it can help you feel safe and supported. And it lets us know that we're all unique and will be taken care of by the divine. And doesn't that just kind of relax your stomach thinking about that you just are, you're taken care of? That's what Manuka can do for you, and that's why I would put it on my stomach. So then I would go to the small intestines, which is this area here on both feet. Small intestines, I chose ginger. The small intestines is where we assimilate life experiences. It addresses some of the negative emotions that we feel or that get stuck in our small intestines would be the feelings of stuck or lost, just completely lost. And so I chose ginger because ginger is the oil of empowerment and can help you feel capable and instill that warrior-like mentality, so that the warrior-like mentality based on integrity. And remember, I said integrity is what's held in our immune system, and that is in those little whatever Delores called those things in the small intestines, the little adenoids of the small intestines. So the integrity, yeah. So I chose ginger for that. It can also help you to remember that integrity gives us the strength needed to take in our life experiences and gain nourishment, because this is where we get our nourishment out of our food, is our small intestines. And so we want to have the courage and the strength to actually accept the help when it comes. Okay, so the next point that I would do is the large intestines, and you're going to always start on your right foot with any of these points. If they're on both feet, start with the right foot. But especially with your large intestines, you want to start here and follow these arrows up the ascending colon, across, and then down and out. So that is the direction of flow in the body. So anytime you're working on your feet, do your right foot first and then your left foot, but especially with your large intestines. Your large intestine is the center of security, security with life and life situations. So this is where we hold on to things. We may have some hoarding tendencies, or are defensive. because we don't want to let go. We don't want to let go. We hold on to the past. So what all this is resistance. Resistance. So a lot of people, myself included, especially when I was a young mother, I would have the thoughts that, the only way that I can get a break is if I get sick. And it's the only way I can get a break, And so that thinking, eucalyptus can help address those emotions, that dependency on getting sick, or, needing a break so badly that, that's the only way you feel like you can get a break. So eucalyptus is the oil of wellness, and it addresses escapism. It can help you let go of the attachment to illness. So that way you have the strength to resist that need to escape. The next point would be the pancreas. And the pancreas, let's see, where's it showing here? This is different. Okay, so I guess it's this little gray area here. So it's going to be more, should be more on the left foot. I'm sorry, guys, I didn't really examine this picture. But anyway, the pancreas is going to be more on the left side than the right. And I chose the Kids Blend Stronger. The pancreas represents the sweetness of life. So you can enjoy like you were when you were a child, that innocence. That's what the pancreas is all about. And so that's one of the reasons why I chose Stronger Blend, and because it has Litsea in it, and rose and frankincense and cedarwood, all great support for the pancreas, in my opinion, and especially Litsea. And Delores knows how much I like that oil. But so it gives strength that helps you to tap into divine strength that is always there, always available. We're all unique individuals, and we all have access to this divine strength. And that's what Stronger is about to me. Then the liver is here, and it is only on your right foot. So the liver is our survival center, life flow, the seat of anger. But it's also where miracles take place in your liver. That's where toxins are removed, and things that clog up the excretory system, which is the system that gets rid of our waste, right? So so we want to support it so that anger and bitterness doesn't build up and clog the chimney. So geranium is the oil of love and trust. It encourages empathy, forgiveness, restores love and trust, which is, to me, the opposite of fear. So that fear is what we want to get out of, because that was the original emotion. The stomach holds as fear. So there you go. That's my little treatment there for supporting the digestive system and immune system. And just as a little side note, a little personal story, all that she told you about supporting the immune system through your digestive system and all those little tips and tricks, my family went through this the beginning of this year. My husband was diagnosed with cancer, and we went to the cancer treatment center, which is integrative. They're about integrative medicine. And so we saw a naturopath doctor like Dr. Delores here, and they gave him recommendations and all the stuff that she was talking about, the zinc and the extra vitamin D, the vitamin C, they gave him high doses or recommended this really good vitamin C that was super high, and a nutritional drink that you can't buy in the store. It's a prescription only, and um, you can totally make a roller bottle and do the whole foot if it makes it easier for you. Working on your individual organs is awesome, but for convenience, if you're in a hurry or whatever, no, a little oil, whatever oil you can get on your body is better than no oil. So so anyway, we also took they also sent us to a nutritionist, and so she addressed nutrition and how that eating, which we were already doing a whole lot of this stuff. You know, we've been in this for several years, but she just added, you know, a couple of things that we had not thought of, and one of the things that she added was to help his digestive system, which was kefir. And even if you're, you know, don't do dairy, you can find a non-dairy kefir. But all of this they did to support his immune system for a couple of reasons. Number one, because he was having surgery, and so that helped strengthen his body so that he could recover faster from the surgery. But it also, your immune system is what takes care of cancer cells. And so that he still does this because, you know, chance of recurrence, to keep it down. So all of that stuff we did also. And we also take Manuka honey when we start feeling a little bit like maybe we're getting a little bit low. We'll start taking a little spoonful of Manuka honey. I also like Manuka essential oil. I'll start rolling it on my throat and my glands when they start, you know, when it starts to get ticklish. And also, of course, elderberry syrup. We do that. I keep that on hand. And so I think that's all that I've got. Were there any other questions?
I don't think so. That is awesome information, Alicia. Thank you.
Thank you.
You guys take a screenshot of this so that you got a good picture of it for the future. All right, and like Alicia mentioned, you know, here's some items for immune support provided by doTERRA. Of course, the Stronger she mentioned. Of course, Breathe is amazing this time of year. Here's the entire On Guard line. I think having it in every corner of your home's needs is a great way. Digest Zen, you may think, well, my digestion, you might have thought before this presentation, my digestion's good. I don't need Digest Zen during the winter months, but now you can see you need it all the time. I keep Digest Zen Touch in the bathroom so that when I get out of the shower, it's right there. When I'm in there getting ready for bed at night, brushing my teeth and stuff, it's right there. I can put it on a second time. And then you guys have been on my presentations. You know how I feel about DDR Prime. I think it is like probably the best thing doTERRA ever came out with. It's a powerhouse to help with our DNA. And then if you've not looked into the wellness programs, this is a great time to start the immunity wellness program where that they are sending those products month one. You'll get a certain set of products, and then they'll replenish you month two with another set of products, and some of them are repeated, and then in month three they're going to do the same. And so you can do this to get through those months that are a little more trying during the winter, just to really support. And if anxiety and stress is a big part of it, then you can definitely look at the other kits. So you got the Mind and Mood kit, which is great to help support your anxiety and stress and sleep, because we've talked about how that is super important in making sure that all of that is supported so that your immune is able to stay strong. And then relief kit if there's any pain involved, because Pain causes stress, which, you know, will impair the immune system as well. So look at those wellness systems. Of course, you guys know I love Symphony of the Cells. If you've ever been one of Boyd's presentation and you see pictures of doctors' patients' feet, those are my patients up there, because this was a huge part of my practice in Portland, where I did Symphony of the Cells, followed by far infrared sauna on almost every patient. You could also do the aroma touch technique. I loved that before Symphony of the Cells came out. My favorite is infectious disease. Of course, for this time of the year, infectious disease cannot be beat. We keep infectious disease, that entire protocol, in the bedroom. And so that if at any point that either one of us start to feel like something's coming on, we start that immediately and then get in the sauna. You can also follow it just with a heat application. So if you don't have time for a sauna, or you're, you know, kind of ready for bed or whatever, you can just get a hand towel, wet it with really hot water, put it across the back, and then cover it with a dry towel, and then bundle up. You can also do a hot shower. So that heat afterwards really just intensifies the oils. So let's dive into some naturopathic ways. And I know that we're running over the hour that I usually try to go, but I knew immunity would be a little bit longer. So we're going to talk about Nature Cure. This is bath houses that we see in Europe. We're going to talk about some water cure techniques. We'll include warming socks, hot and cold contrast, including towel showers, foot baths. We'll talk about Epsom salt baths, cold mitten friction, herbal support. We're going to revisit a little bit about elderberry syrup and some echinacea. And then there's some nutritional support, and I got some recipes up here for you guys. So warming socks. If you're not familiar with warming socks, you need a screenshot of this, because this is amazing to use with any time that you're feeling like you're coming down with something. So the best way that I like to do it, I like to keep this flume balm that you see there down here in the bottom. You guys, if you need that recipe, it's on Pinterest. There's a lot of varieties, and I think that Alicia actually had it in her recipe slides. So I love it in a roller bottle, and then we just apply it on the bottom of the feet. First you want to warm your feet. I love an old-timey hot water bottle. You can get them at the drugstore. You just fill it up with super hot water, throw it in under the blankets in the bed, and get in there and get your feet nice and toasty. You could soak them in hot water if you want to do that. I like to already be in the bed and have everything ready. So once your feet are nice and warm, you're going to have all this stuff prepared and on your bedside table or somewhere close. Once your feet are nice and warm, then you're going to get those oils on them really quickly. You're going to put on a pair of thin and hopefully cotton socks, and you want to have wet them in cold water, not ice water, but cold water. You want to wring them out super well. Make sure that they're really wrung out well. And so your feet are warm. You're going to put those wet socks on over on top of the oils, and then you're going to put a pair of wool socks on. If you don't have wool socks, just put 2 pair of your thickest socks on, and then you want to put your feet down in the cover. Take the hot water bottle out, because you don't want them on the heat then, and bundle up so you're really warm and go to sleep. Here's the way this works. Your feet were warm, and then you shocked them with cold, and then you left the cold on there, and then you covered them up with warm. So then the intention of your body fully goes to your feet. So if you have like chest congestion, if you got a fever, if you got a runny nose, anything's happening, the way that what happens is your blood circulation significantly increases, because it's trying to warm your feet and dry those socks. And so your blood circulation greatly increases, your lymph flow greatly increases, your body is going to work, you're going to sleep. And sometimes if I can't sleep, I'll actually do warming socks, because it's the best night of sleep you could ask for. It just feels like it knocks you out. And when you wake up, you could wake up in the middle of the night, and they're crispy dry, those wet socks are. And so it's a great way to just like help pull all of that congestion out of your lungs, because your blood flow is circulating so much better, and your lymph flow is, so that it pulls all of that stuff out of a condensed area and then gets it into your lymph nodes, so that you're B cells and T cells can take care of it, right? And so you want to make sure that you can do this until your symptoms are clear. And so typically we tell people 3 nights in a row at least. You could do it a week if you needed to, or however long it takes till your symptoms pretty much are clear. You do not want to do this if you're not able to get your feet warm or if your body is cold. So if you're chilling, if you're shivering, do not put the cold, wet socks on because it can actually make you worse because you need that shock of hot feet, then cold socks, and then bundle up. It has to work that way. If you put them on cold feet or if you're cold, you actually cannot get colder and colder during the night and wake up feeling much worse. So you want to make sure that you take that step. Another thing is you don't want to get up and walk around on these socks because when you do, then you wet the wool socks and it really impairs that system. And so it takes the warming a lot longer. So that's warming socks. It's a great treatment that I use in my practice. So it's a great way that you can just support your family's well-being. Hot and cold contrast. This is another great way to use water. We call it water cure. So it's a great way to use this, just the contrast of it to really improve your white blood cells. Remember what white blood cells are. White blood cells, there's those lymphocytes, so those B cells and T cells. We want those numbers to be a lot, right? We want our body's immune cells to be in high number. And so studies have shown that hot and cold contrast actually increase the number of white blood cells you have. And so you can do it in different ways. You can do a foot bath. So you can just get, like Rubbermaid totes. And I like to take a teapot and set it on the floor beside my hot one. And then maybe you need extra ice in a bucket beside the cold one. And so you're going to do 3 to 4 cycles. So you like to have a timer and you want to do 3 minutes of hot or warm. You don't want it hot that it's going to burn. You want it hot enough that you can tolerate it easily. And then 1 minute of cold. And you always want to end on cold. And you can do this in the shower or you can do it in the foot bath like you see. Or you can also do it with hot towels. And we have there's actually a treatment we use in the clinic. It's called constitutional hydrotherapy. And it is alternating hot and cold towels. And then we use electrical stimulation mixed in with that. And it significantly increases immune system. And so with the towels, you want to make sure that once you put a wet towel on the body, you cover it with a dry towel so that it's not getting the sheet and blanket, whatever you're using, wet. And then you want to make sure you bundle them really well in between that and do the 3-to-1 ratio as well. You could also do a scarf. So you can wet a thin scarf in cold and do 3 minutes of a hot towel around your neck and then 1 minute of cold towel around your neck or scarf, however you want to do it. So you can do the showers. And if you're not able to do alternating hot and cold showers, a great simple technique that can just get you through the winter a little bit is just to always end on cold. When you're in a hot shower in the morning, just as you're done with your shower, just start working that dial over to cooler and cooler and cooler until it's cold for a minute and see if you can stand it for a minute and then get out and you'll be a lot more alive for the day. Oops, went the wrong way. Okay, and so next is Epsom salt baths. This is a great love of mine. It's called balneotherapy, that's bath therapy. I did a lot of training with this with doctors that trained in Europe. Epsom salt is very high in magnesium. It's very relaxing, so that's also going to help the stress component and the sleep component in your immune support. There's a water saturation rule where you add salt, Epsom salt, until no more will dissolve in the water. You never want to use less than 4 cups in a standard size bathtub, or you're kind of just wasting your salt. Optimal is full saturation. When I lived in Oregon in my house, I had a soaking tub. It took 32 cups to saturate the water. So what that means is you just keep adding a cup at a time. And and you just swoosh the salt around and make sure that it dissolves. If it won't dissolve, your water is fully saturated and you're going to feel like heaven when you get out. One way that you can get this really inexpensively is check like with a co-op or a feed store for bulk prices, because a lot of times you can get it super, super cheap. You want to soak until you're done. There's no time limits. You don't want to have your phone in there or watch TV in there. Just relax. You want to add your favorite non-citrus oils, because citrus oils in a hot bath can burn your skin. So Epsom salt, use a lot of it. Make sure it's non-scented so you can add your own oils to it. But remember that water saturation rule. You want to make sure that you're getting a lot in there. So what I was saying with checking the feed co-op, like we would get a 50-pound bag for $25. So I would go buy 200 pounds at a time and just put it in big Rubbermaid totes in the hallway. And so it's a great way just to fill your tub up with water, salt. Cold mitten friction. This is a really old technique. And you can see it stimulates the circulation of the skin, increases the rate of blood flow, increases white cell activity and antibody production. It also stimulates neuromuscular tone, reduces fever, and vasomotor tonic. And so the way that you do this is you really just take a washcloth, you wet it in cold water, wring it out, and then you kind of like wrap it around your hand, and you can see you start away from the body and work towards it. So if you've ever looked at dry brushing, it's that same technique, but with a cold, wet cloth, and you're creating some friction. And so you're basically just like, it's almost like you're giving your child a scrubby bath, but you're just scrubbing towards the heart. Start with the hands, you work towards the shoulders, you do the legs, you do the chest and the abdomen, and you do the back. So that's cold mitten friction, and it's really awesome. It feels great. Herbal support, Alicia was talking about elderberry syrup. You can make your own. This time of the year, though, you're not going to be able to buy elderberries. They're all sold out pretty much. So you can buy elderberry syrup. There's some great brands of it. Echinacea is great, especially proactively. It can help a little bit once something has taken hold, but it really helps proactively if you just drink echinacea tea every day or something that's really supportive. Adaptogens also, because this is going to help that stress response. So Tulsi, whether you're doing the oil in a tea or taking an herbal form of Tulsi, which is holy basil, of course. Ashwagandha is another great adaptogen. And then digestion, supporting that. Like we love using bitters. Bitters is very stimulating to the digestive system. It's basically a way of telling the system, kick in, start making some enzymes, we're bringing food in. And then also ginger, like you can use fresh ginger, you can use the oil of ginger. It's a great way to support the digestion again. Naturopathic nutritional support. So here's some recipes I want to share with you. So Beeler's broth, I didn't get this recipe. I looked, and you can Google it, super easy, but that's the way you spell it, is Beeler's broth. And this is it on the far right. One of my mentors, Dr. Pamela Jean, she had surgery when I was in medical school, and she called me and she said, could you make me some Beeler's broth and bring it over here? So I took her like 3 quarts of it to the hospital, and the nurses just kept warming it and feeding it to her every meal, and she recovered very well. She had to have part of her colon removed. And so it really helped in her healing, because it's just a really restorative soup. It's very, you may think it's plain, but when you're ill, it's very healing to your system. So it's a great way to reintroduce food, because the thing is, once you develop a fever, you need to back off on food. You don't want to feed your body things because your body's working so hard that it's got to stop working and come and digest your food. So you want food in your body that is extremely easily to digest. And then kitchery, for those of you that have worked with me, I do a lot of Ayurvedic medicine as well, just because it's a passion of mine, and one of my best friends is an Ayurvedic doctor as well. Kitchery is a healing Ayurvedic dish, and you can just Google that recipe. It's super easy. We make it a lot. It's just lentils and rice and seasonings, and it's delicious, and it's really extremely nutritious. And then Dr. Pamela Jean, she had this alkaline drink because, you know, a lot of pathogens cannot survive in an alkaline environment because if it's acidic, it'll thrive. If it's alkaline, it can't survive. And so you can make this drink, and it's really delicious. My grandchildren love this drink. And it's just organic lime juice, ginger, you know, some fresh ginger. And actually, it's fresh ginger. It's not. I've got fresh ginger juice, but it's ginger. 1 to 2 tablespoons of honey, some filtered water. You blend it all in a blender, and you just put it in the refrigerator, and you just drink on it for a week. And you just keep making it over and over. So screenshot this because you definitely are going to want that recipe. And then sauna is amazing. So I use a far infrared sauna. This is actually the far infrared sauna that we trained on in medical school just because of the research on this particular sauna. And this is what I use in my clinics, and this is what I use here. I have one here in my home. And so there are studies, you know, there's a study in Finland that showed that it helped with hormone levels and immune response, that of course, your core body temperature increases. It can,
the picture back. I don't know what happened.
what's that? I'm sorry.
Like you're gonna close it all up.
I did, but
Hold on just a minute. So
I can't.
there we go. Okay, let's see if that helps. And so significant increase in white blood cells. We saw there was a 34% increase in lymphocytes and an increase in those natural killer cells. So there was a Mayo Clinic paper showed fewer colds, flus, and lower risk of pneumonia with using far infrared sauna. It boosts the body's immune response. So this is the one that I use and I use this one because of the research that was done on this particular one of low chemical exposure, low EMFs, and because your head is out, you can tolerate extreme heats for longer amount of time than I can in one that my head is in. Okay, let's see. I think that's about all I've got. Lifestyle support, you know, you want to look at steam inhalation, plants in your house, meditation, walk in the woods, laugh a lot, you know, because laughter is great for your immune system. These are the references that I use. And then I told you it's going to have some special offers. Screenshot this because some of these end at the end of the month. If you like that sauna, I've actually been running a special on this because I have a deal, because I use these so much in my clinic and I use them so much with my patients that I actually cut a deal with the company where I can get a super special deal on these. The regular price is $1,300. And I'm doing a deal for $975 until the end of this month. And I'm not supposed to sell them that cheap, but a doctor had a patient that had financial difficulties and I was able to negotiate this price. So I thought, I'm going to throw that offer out to you guys too. So if you want that. Also, I talked about grief. If you're looking at doing some grief recovery work, if you're attending these, you get a 20% discount, which is $150 savings. But if you're looking at working with me as in a doctor-patient role, if you're out of the state of Washington or Oregon, I can work with you on a health consultant role so that everything is done online where, you know, I specialize in mystery illness, chronic illness, autoimmune, EBV, herpes, Lyme, chronic fatigue, hormone imbalance, GI dysfunction. You can look and see about getting a free consultation just to see if working with me is a good fit for you and your goals. This link right here is my scheduler. If you want to take advantage, you can, I've created a code for you guys only. Just type in the code immunity and you'll get 20% off of the initial visit with me. It's a $55 savings. So that's a great savings just for you guys. I want to thank you guys so very much. I had to say it, go vote, but thank you for your attention. I know we went longer tonight, but it was so much information I wasn't sure I could cram it in. So if you have questions, let me know. I see there's some chat. Thank you guys. If you have questions that come up later, feel free to reach out and ask me. But remember, if it is something specifically related to your issue, I may not be able to answer that. So Thank you, everyone. I appreciate your attention and staying with me. I know we're running late and it's late in certain areas. So I really appreciate your patience. So awesome. I'm just reading the chats. It's so good to hear from all of you. And you know, next month, feel free to invite people that may not even have an account yet, okay? Because I want you to know that this is open to everybody, because it also even goes out on Eventbrite, so it's open to the public as well. But invite anybody that you want to just hear our information, you know, because I not only want to support our global team, I want to support you in helping educate the people that you're working to educate, okay? So even if they don't have oils yet, and you're just talking to them about oils, invite them to this. Everyone's invited to this, okay? So thank you, everyone. And we will see you all next week. I'm sorry, we say that because we just got off continuing education too. So see you all next month. I will be posting that link within the next couple of weeks, and I'm working on that breathwork class too. So everyone have a good night. Let me see this one last year. What's your contact number for sauna? If you can email me at Dr. Delores, DoloresStevensND@gmail.com for more information. Then we can, you know, schedule a time to chat or something for that. I'm working on getting a local number here because all I have right now is my personal number. So yeah, just shoot me an email, or if you're a friend of mine on Facebook, we can also chat through Facebook and then arrange a phone call. All right, thank you guys so much. I'm gonna stop the share, take one more picture of this screen if you need to. 3, 2, 1, there we go. All right, thank you, everybody. See you all next month. Thank you, Alicia. Really appreciate your help.
Thank you, everyone.
You do great.
Yay.
Awesome. All right, thanks, guys.